Okay, today I'm going to be reviewing the method for safely drawing up and getting ready to administer a vaccine without changing your needle. So using the same needle for drawing up and administering. Currently, the CDC is not recommending changing your needle between drawing up and administering the COVID-19 vaccine. So first thing you want to do is confirm that you have enough vaccine in your vial for the full dose. So for the Moderna COVID-19 vaccine, each vial should contain about 10 doses, and each dose is going to be 0.5 ml. You also want to check the expiration date on the vial, as well as confirm the use by date. So we should be keeping track of when each vial is opened and when each vial is thawed out. Once you have confirmed that your vaccine is correct and is within the use by date and well within the expiration date, you're ready to get to draw up your vaccine. So the first thing you're going to want to do is use your alcohol swab and get that vial top nice and clean. Because it's a multi-dose vial, you're going to really need to make sure that you clean the top of that stopper really well, because it's been used before, so it's not sterile. So I usually clean, for a multi-dose vial, I usually clean for a full 15 to 30 seconds. Once your vial has been nice and cleaned, then you want to get your syringe and needle prepared. Again, you want to be using the needle that you're going to be using for administration, because you're not going to be changing your needle between drawing up and administering. So for this example, I'm just using a 25 gauge 1-inch needle. So, as I said, you get that prepared as you usually would. So you take your syringe and you screw it onto your needle without touching the hub of either the syringe or the needle. And because we are going to be recapping this needle, you want to be very careful and mindful of where the cap to your needle is. So you want to make sure that you don't just like take your cap off of your needle and then just throw the cap somewhere, because you need to try to ensure that it remains sterile. So I like to keep it in the sterile package to just ensure that it stays sterile. I do want to emphasize that you should never recap a needle after it's been used on a patient. So the only time that you're going to be recapping a needle is when you're giving the COVID-19 vaccine, and it's going to be when you're drawing the vaccine up and before you actually go to administer the vaccine to the patient. Never recap a needle after it has been used on a patient. So now that my vial has been cleaned and is ready to use, my syringe is ready. So how you're going to make sure that the cap of the needle stays in the package is you're going to kind of get your safety prepared as you usually would. You're going to keep the needle in the package. You're going to hold on to the cap and you're going to pull your needle out as you typically would. So now you're going to get prepared to draw your vaccine as you typically do. So I'm going to pull back 0.5 mLs of air. I'm going to insert my needle into my syringe or into my vial, inject the air, and then draw back my dose by flipping the vial up. Once I have my dose drawn up into my syringe, you don't have to worry about pulling back any air, or you also don't have to worry about priming your needle, because your needle should already be primed. The only caveat to that is if you accidentally did pull back some air, or if you have a lot of bubbles in your syringe, you may need to pull back some air to get the bubbles out. But because you're using the same needle to administer the vaccine, you don't have to worry about priming because it should already be ready to go. So instead of putting my safety up at this point, I'm going to recap the needle. So this can get a little bit tricky, because you don't want to just grab the cap of the needle and just stick it on there, because there's a high likelihood you might stick yourself. So the method that we use to recap needles is you're going to take your needle and you're going to keeping the cap on the counter. You're going to sort of just thread your needle into the cap and sort of scoop it up. And then you can kind of push the cap on more secure. So now I'm ready to go and administer the vaccine, and I safely used the same needle for the drawing up, and then I'm going to use the same needle for administration. Again, you can only do this you can only use the same needle and recap your needle for the drawing up and then going to administer. After you administer the vaccine, you should never be recapping, and you should always be putting your safety up and disposing of that syringe and needle into the sharps container.